Paul Gately's here from Leeds Beckett University, who looks at the role of obesity and exercise. Flabbergasting, it says in The Sun. NHS plan on child obesity. Obese children will get free scales under a new NHS weight loss bid, but they won't be able to see the readings. Sounds a bit mad, Paul, doesn't it? Morning.
Yeah, it does to me, to be honest.
I mean, surely you give them a scale and then let them look at it, don't you?
Well, that would be educational, let's say.
Yeah.
We would also encourage them to be reflective so they understand where they are and where they're going.
Yeah.
So I'm a bit surprised by this as an approach, basically.
Yeah.
But in a sense, this is one of the challenges we face, that the sort of health system needs to change, and in many ways it's not changing. You know, we've got the vision of the health secretary of community rather than being in a hospital, and yet these children are going into hospital for care that they really could do within the community, and it's much cheaper.
Yes. I mean, the Obesity Health Alliance are saying that this is a compassionate approach, but it doesn't seem like it. I mean, it's more likely to sort of demonise kids, isn't it? I mean, as I say, if you kind of did it in a more rounded way and said, look, why don't you try and keep track of your weight, maybe you know, weigh yourself every week or something like that and see how you're doing, make it fun, make a chart out of it, you know, that kind of thing. But if you're doing it so that somebody else is kind of spying on you, it's a bit weird.
It is weird, and I think, you know, there's always well-intended plans, and what we hear from a lot of adults is when people focused on their weight when they were younger, it didn't go to plan.
Right.
And I think part of this is that it's not about the monitoring, it's really about how the information's shared, what support children get, what support families get. Is that communication stigmatizing or is it supportive? And in the past, it was very stigmatizing. It's your fault, child, or it's your fault, parent. Whereas now, really good quality interventions are much more compassionate, but they bring the children and the families with them. And so for me, this is not a really good measure and a helpful step.
No.
It's not a helpful step.
And what do you think is the cause of so much more obesity in children these days?
Well, the simple reality is, you know, there's a variety of things. We know food's still a problem. We live in an environment where the food's too prominent, too easy to access. 5 years ago, you would never have seen so many Deliveroos, and yet they're everywhere now. Physical activity is a problem. Schools, PE has disappeared from the school curriculum. Children are on devices that limits their sleep, and we know sleep's really critical, and children that sleep less than 8 hours a night are 50% more likely to have a weight problem. And yet no one's talking about this, and yet it's probably one of the biggest drivers. Certainly a sleep scale will be better than a weighing scale.
Yeah. And just even education, presumably, for the parents as well, who must be assuming that... I mean, it's not cheap either. I mean, you talk about, you know, all of the food delivery companies, you know, and there's many of them, but that's not really particularly a cheap way to eat either.
Not at all. And I think for parents, it's not easy. Okay, that's the first thing I'd say. But with some support, we know that we can help parents change their lifestyle. And one of the problems I have, if parents and children don't know their weight, then how are they going to do something about it? How are they going to take responsibility? How are they going to take ownership if it's in the hands of a clinician? That is not a good future model.
No, it really isn't. So, I mean, if you have a child and you're a parent and you think that they're maybe putting on a bit too much weight, what would you advise them to do?
So I'd advise, I look after a charity called Obesity UK. We have about 35,000 members, and that's the support group, so families can go onto our website, get support, access forums and Facebook groups, and get some expert advice. That's really a first port of call.
Yeah, okay. Good to talk to you, Paul. Thanks very much indeed. Paul Gately from Leeds Beckett University. I mean, whoever came up with this idea has got to be off the scale mad. Pardon the pun. I mean, if you're going to give them a scale, let them watch it and look at it and see what it's doing.